Welcome to 6ABC's Local Spotlight. The following advertisement is paid for by Mainline Health. Here's Jessica Boynton.
Mirmont Treatment Center, part of Mainline Health, is an inpatient facility located in Media, Pennsylvania, that's been successfully treating substance use disorders for patients ages 18 and older since 1985. Mirmont focuses on treating the entire person, not just the symptoms. Experts create an individualized plan for each patient, blending evidence-based approaches with holistic therapies and clinical excellence with compassionate care. Mirmont also offers a variety of mental health services at its outpatient locations in Brumont, Exton, and Media. At Mirmont, the disparities and everyday stressors that many in the lesbian, gay, bisexual, transgender, and queer questioning communities face are addressed. Members of the LGBTQ community often experience feelings of shame, guilt, isolation, and also may have difficulty accepting who they are. We're here today with Sarah Aked, clinical social worker with Mirmont Treatment Center. Sarah will talk to us about what Mirmont is doing to address the mental health need for members of the LGBTQ community and their loved ones. Sarah, thank you so much for joining us today.
Thanks so much for having me. I'm happy to be here.
So Mainline Health is committed to inclusive care. What can you tell us about inclusive care and why is it so important in healthcare?
Yeah. So inclusive care is the idea that healthcare should be accessible to all people, no matter who you are, your age, or your stage in life. And we also recognize that, especially for minority communities, that there are very real practical barriers that prevent people from accessing high quality care.
So how is Mainline Health addressing the mental health needs in the LGBTQ community?
Yeah. So we want people to know that they are welcome here. We're a healthcare environment that's inclusive to all folks. And we know that many LGBTQ people will avoid healthcare checkups, primary and preventative care, or mental health care. They may be afraid of discrimination, or they may have experienced it from providers in the past. So we know that the avoidance of primary health care, when it's paired with higher rates of anxiety, depression, or substance misuse, which is a result of discrimination, can be really detrimental to health outcomes. So again, we want to situate ourselves as a healthcare system which is welcome to all people and that people feel safe here.
So I understand there's a new outpatient behavioral health program dedicated to adults who identify as LGBTQ. What can you tell us about that?
Yeah, so I started SAGE at the beginning of this year. It stands for Sexuality and Gender Expansive, and it's a mental health intensive outpatient program, which includes dialectical informed behavioral therapies, psychoeducation, and mindfulness as well. It's open to anyone who's 18 and above and out of high school and who lives with a primary mental health diagnosis. We accept most private insurance and we also accept Medicaid.
Are there any other tips you would like to give the LGBTQ community?
Yeah, just that your mental health matters. Your brain is an organ, and if you were struggling with your heart or your liver, I would give you the same encouragement to seek highly specialized care, seek the best care that you can. And so I'll give the same encouragement in this situation that if someone you know is struggling with their mental health, they should seek a provider who's going to take their experience into consideration as an integral part of their recovery.
All right, well, Sarah, thank you so much for sharing this important information with us. That was all very helpful.
Thanks for having me.
All right, to learn more, you can visit mainlinehealth.org/wellaheadphilly. Thanks so much for watching. Have a great rest of your week.
Thanks for watching 6ABC's Local Spotlight. The preceding advertisement was paid for by Mainline Health.